Howdy, folks, and welcome back to the channel where we dig up the dusty, often downright bizarre history of the American West. Today, we're sinking our teeth into a topic that'll make you grateful for modern dentistry: how cowboys dealt with a toothache. So grab your floss because this is going to get a little gritty. Picture this: you're out on a long cattle drive, miles from any semblance of civilization. The sun is beating down, the dust is everywhere, and then it starts. That low throbbing ache in your jaw, a toothache. Today, you just call your dentist. But for a cowboy in the 1880s, the options were a bit more rustic. There were no gleaming white offices with reclining chairs and gentle hygienists. Your dentist was likely the camp cook, the town blacksmith, or if you were really unlucky, just the guy at the saloon with the steadiest hand and the strongest pliers. The first line of defense, as it was for many ailments on the frontier, was whiskey. And not just a little sip to take the edge off. We're talking a full-blown, face-numbing, I-can't-feel-my-own-name level of intoxication. The idea was to get so looped that the pain of the cure would be less than the pain of the tooth. But alcohol was a temporary fix. When the ache returned with a vengeance, it was time for more hands-on methods. This is where things get truly wince-inducing. The most common tool for frontier extraction was a pair of pliers. Not surgical-grade sterilized pliers, mind you. We're talking about the same rusty, grimy tool used to fix a wagon wheel or mend a fence. The patient would take a heroic swig of whiskey, bite down hard on a piece of leather or a stray bullet, and hold on for dear life. The dentist would then go to work trying to get a good grip on the offending molar and pull. It was less a medical procedure and more a wrestling match between a man and a tooth. If pliers weren't available, cowboys got creative. Some tales speak of the door slam technique. A string was tied to the bad tooth, the other end to a doorknob, and then slam. Hopefully the tooth came out. An even more extreme version involved tying the string to a horse's saddle. A sudden slap on the horse's flank, and yank, tooth gone. One legend, which sounds almost too wild to be true, tells of a man tying his tooth to a bullet, loading it into his pistol, and pulling the trigger. Talk about a high-caliber extraction. Now, did that actually happen? Probably not, but the fact that the story exists tells you everything you need to know about their desperation. Another popular remedy was chewing tobacco. The idea was that the nicotine and other chemicals in the tobacco would numb the gum and kill the pain. Some even packed the cavity with a wad of wet tobacco. While it might have provided some temporary relief, it was hardly a cure. In fact, it probably just made things worse in the long run. Then there were the so-called toothache drops sold by traveling patent medicine salesmen. These little bottles promised instant relief with concoctions often containing cocaine, opium, or straight-up alcohol. They'd numb the pain, sure, but they were also highly addictive and did nothing to fix the underlying problem, which was usually a rotten tooth. An infection could easily set in, leading to a swollen jaw, a condition they called the bloat, which could be fatal if it spread. Some folks tried more natural remedies. Clove oil was a known pain reliever, and if they could get their hands on it, they'd dab it on the sore tooth. Others believed in burning a specific type of weed and inhaling the smoke. There was also a bizarre belief that placing a roasted turnip against your cheek could draw out the pain. It's safe to say the placebo effect was doing a lot of heavy lifting in these situations. The blacksmith was often the go-to tooth puller in town. He had the muscle, the tongs, and the nerve to do the job. He wouldn't sterilize his tools. A quick wipe on his leather apron was considered good enough. You'd sit on a crate, he'd get a good grip with his forceps, plant his boot on your chest for leverage, and pull. The crunching sound was something you'd never forget. And there was no guarantee he'd even get the right tooth on the first try. The real professionals, itinerant dentists, did exist, but they were few and far between. These traveling tooth pullers would set up a chair in the middle of a dusty street. often with a brass band to drown out the screams of their patients. They used intimidating-looking tools called tooth keys or pelicans, which were designed to hook onto the tooth and twist it out. It was brutal, effective, and a great spectator sport for the whole town. So why did they have such terrible teeth? Their diet was a big part of it. Lots of dried meat, hardtack biscuits, and sugar in their coffee when they could get it. And dental hygiene? Non-existent. A toothbrush was a luxury few had, or even knew about. At best, they might rinse their mouth with water or whiskey. The result was rampant decay, gum disease, and agonizing pain. In the end, for a cowboy, a toothache wasn't just an inconvenience. It was a serious, life-threatening problem. The cures were often as horrifying as the ailment itself, a brutal mix of desperation, alcohol, and sheer force. They faced these dental nightmares with the same stoic toughness they applied to every other hardship of frontier life. It gives you a whole new appreciation for that little tube of toothpaste sitting on your bathroom counter, doesn't it? So the next time you're sitting in a comfortable dentist's chair, just be thankful you do not hear the jingle of spurs or the offer of a shot of whiskey before the procedure begins. Thanks for riding along with us on this historical deep dive. If you enjoyed this trip back in time and want to see more, make sure to hit that like button, subscribe to the channel, and ring that notification bell so you don't miss our next adventure. We'll see you down the trail.